Right, welcome, Dr. Jessica Eastman, a fellow CCNM colleague.
Mm-hmm.
And so we recently connected over, yeah, well, I guess like topics around psychedelics and mental health and some cult psychology and spiritual bypassing. And but I think what we want to talk about today is like mental health and maybe some psychedelics and trauma, and because that's a big part of what you do and what your practice is in BC. And
Yep.
yeah, maybe you could introduce yourself and tell me a little and tell the audience a little bit about your practice.
Yeah, for sure. Yeah. So I am a naturopathic doctor licensed in British Columbia. I've been practicing there for almost 10 years. And I also am a psychedelic-assisted therapist and, as I call it, a trauma recovery coach. Um, so I kind of mash together integrative psychiatry and integrative mental health work with trauma-informed primary care and some psychedelic assisted therapy, like prep and integration work. I don't do the actual medicine sessions because it's not in my scope of practice. Um, I could do that if I was like working under another like field trip or numinous or something like that. But I get a ton of value in doing like harm reduction discussion and prep and integration. And I have a little niche of people who come to see me when they've gone to do psychedelic assisted therapy, usually with an underground therapist who wasn't super well trained and they had a bad experience.
Mm.
And then they're looking for somebody to like help them sort that out. Also, because a lot of psychiatrists and psychotherapists and psychologists and medical doctors don't have a whole lot of training or understanding about psychedelics. And so these people sometimes come to me, they're like in inpatient psych, and their psychiatrist is saying, like, you've broken your brain and there's nothing we can do to help you. And then they call me kind of like as a last ditch effort to be like, hey, is my brain really broken? And I get to say, like, no, it isn't actually. We can heal this and we can work through this. So that's a really fun little niche that is developing. There's like more and more need for that. And then I do some trauma recovery coaching specifically, both in my practice and separately. So I get to kind of weave a whole lot of mental health stuff together.
That's really cool. That's really, really, really interesting. I know BC has a more expanded scope than Ontario when it comes to, like I think I talked to Ray St. Arnold about ketamine therapy and like that's in scope or like uh, legal for therapeutic use. But yeah, how did you get into and what maybe you can describe because I'm really interested kind of like what the prep would be like in a responsibly administered sort of psychedelic session, like what
Mhm.
kind of prep is usually involved and what's the integration like afterwards if someone's really going about it in like a
Yeah. Yeah,
textbook
totally.
or yeah, safe way.
Yeah. So the prep work is actually done in from anywhere from one to multiple, like 3 or 4, up to like 6 months worth of sessions before you do the actual medicine sessions. Um, and what's involved in prep work is really variable from person to person. Uh, the kind of like universal things that are involved in prep work is getting having a discussion with the client or the patient about what they are expecting, and a big part of the prep work is helping them to get clear on what their goals are and helping to work away from a bunch of expectations and toward like intentions and
Mm.
an opening to the possibility of whatever the medicine is going to take you into. Because a lot of people go into these sessions understandably like hoping that they're going to, be a cure all because they've been struggling with, depression or PTSD or OCD or whatever it is for a long time. And um, psychedelic medicine is a unpredictable in certain ways, and so it's not linear in the way that like when you give this dose of an SSRI, we generally have this response, and when we increase the dose, we have an increased response. And so psychedelics are a more unpredictable world. They kind of work often by teaching you how to surrender and exposing you to feelings and or stuff that you want to work through or that you maybe need to work through.
Mhm.
But going in, the most likely things that are going to create a bad time or a bad trip is if you go in with a whole bunch of expectations, or you go in with the expectation that you're going to be able to control the experience.
Mm.
And so, like, a classic example is like people who come and they say, like, okay, I want to go into this session to heal my relationship with my father. And that sets you up for a challenging session potentially because there's a whole bunch of expectations built into that
Mm.
concept. And so what we often work that into is something more open-ended, is like, my intention for this session is to be curious and to understand more about my relationship with my father, because we don't put expectations on like healing or outcome necessarily, because A, the medicine doesn't do that for you. It illuminates things and helps you to do that work on your own. Um, and B, surrendering or being able to like relinquish control to the experience is a big part of how the medicine works and how it helps you to allow for neuroplastic change and perspective updating. So yeah, that's a big part of kind of like universal prep work with anybody who's doing it well. And then there are some other things that some people need more support in than others. Like some of the things that I personally would, like more or less require, would say like this is a prerequisite to you being able to do this work, is a decent amount of experience and tools in being able to manage uncomfortable emotion, and knowing that you understand like how to know where your edge is in terms of like, I can handle this and this is where my overwhelm edge is and when I need to ask for help. And then also having the skill set of being able to ask for help when you need it. Because like I said, sometimes these sessions are unpredictable and sometimes they're very chill and gentle and like lovely and warm and you feel love for the whole time. And other times they're like, open doors to old emotions or memories or stuff that like can be a flood of discomfort. And it's important that people are not going to be super dysregulated after and not then know how to handle that or get the support that they need.
Mm.
Um, so that's a component of it. And so, if people come with years of psychotherapy experience, then they're probably full up on all of those tools. And if they've never done any of that work before, then we do some of that work first.
Yeah, that's yeah, really useful. It's like, yeah, first of all, kind of like, what are your intentions that are kind of reasonable? And then, yeah, maybe looking at, because one of the things it does, it, like, kind of drops defenses, and sometimes those defenses are there for very
Yes.
important reasons that once they're gone, what do you know, how might you respond, or, how might you find stability? Yeah, like, if there's some things that have been compartmentalized for good reason and now they're blasting open or you're in touch with them or, you
Yeah.
know,
Yeah.
um,
Yeah, exactly. And I think that's the probably the most misunderstood part of psychedelic assisted therapy and all that kind of work, is that people think that the medicine is the thing that heals them, or is that the thing that fixes their brain, so to speak. And it's actually like it reveals a bunch of stuff to you and it puts your brain into a particularly like flexible and malleable state where you have the potential to have neuroplastic change and build new neural connections in the like, a few days and weeks right after your session. So you are more changeable in that period, but the change comes from you and the work that you do a little bit during the session, but in large part after, in the integration work where you're being exposed to or choosing to expose yourself to the feelings that it illuminated and the memories and the awarenesses and the connections, and then how you process and integrate it, all of that into the rest of your life. That's where the change and the growth and the healing really happens.
yeah, in that integration period of
Yeah.
like kind of, yeah, it's like this concept of like ego dissolution. It's like your ego dissolves and you're this raw kind of bare soul. But that's not how we operate through the world. Like, we need to kinda reconstruct the ego, the persona to, like, be able to work your job and be in relationship and parent your kids and, like, all that stuff, right? Like, you can't just
Exactly.
be connected to the trees, um, or, like, in a dissociated state. So it's like, how do we kinda repair and, like, carve new pathways around old traumas or metabolize and reintegrate the traumas that may have
Yes.
been, yeah,
Yeah.
exposed. Yeah.
Yeah, exactly.
what do you find like when people are, so I know you're not administering the medicine, but like what is, because a few patients have asked me, like, especially with treatment resistant depression, that's often like a category where these medicines are really like looked at
Yeah.
and studied. A lot of people who have had kind of lifelong depression, lots of treatment, not really a lot of resolution, maybe some trauma. They're like, maybe I should do an ayahuasca retreat, or what do you know about,
Hmm.
psilocybin-assisted psychotherapy? And like, what do you find when someone's been in years and years of psychotherapy and maybe they've built some skills, they've learned some things about themselves, but what are you seeing with people when they do psychedelic-assisted therapy? Like, is it like what kind of changes or what, you know, what's that like? Because it is framed like a miracle a lot of the time.
Yeah,
The
totally.
marketing.
And
Yeah.
sometimes it is, like, sometimes people's experiences of that are like, "This is actually a miracle," and so it does, like, that rhetoric exists for a reason.
Mhm.
It's just it doesn't happen every single time, it doesn't happen in every patient, it's also really about where you are at in your journey and, like, if the medicine was chosen correctly in alignment with where you're at, and so, yeah, there's a lot of parts, but excuse me, I think that, a big thing that often people take away from psychedelic experiences is new perspectives, looking at the same things they've been talking about or working through or feeling for, months, years, decades, but they get to look at them from a new lens.
Mm.
And so it allows you to see things from different angles. That also often allows you to develop or unlock compassion for yourself in the past or for the other people in the story in a way that allows you to, as you said, like metabolize the trauma a little bit. Feel, process, and release is the language that I use a lot of the time. Um, and as you said earlier, it really also, some medicines more than others, but there's a lot of like dialing down of the amygdala activity during while you're under the influence of the medicine. This is especially true for MDMA, but true in ketamine, psilocybin, etc. And the amygdala is responsible for our fear response and therefore our protection responses, and that is the thing that is often preventing us from being able to really look at and feel the emotions or feel the memory or whatever. Um, and that is there for a reason, as you said, but also when we dial down how intense the amygdala is activated in that moment, sometimes often we can have the memory or feel the feelings without the associated fear and intensity of like a need to protect. And so you're able to just feel it as opposed to it being buffered by your nervous system saying like, it's too dangerous for you to feel this. And so there's
As
often,
container too of safety, so it's like,
yeah.
it's appropriate to have that like reduced defense. You're like, yeah.
Yeah, yeah, for sure. If the psychedelic-assisted therapy is done well and you've got a safe container with a therapist that you trust and it's yeah, so,
Mm.
it often so it gives people often new perspectives. It also gives them an opportunity to, have a big release of feelings. Like, I've heard many people talk about how and this is my experience also, like, it helped me and many others to feel the feelings separate from the story that your brain is telling it for the first time ever. Just like a thing we work so hard at in psychotherapy to try and, like, allow for and validate and make space for the feeling without your brain pulling you into, like, "But that shouldn't have happened," or "I shouldn't have done that," or "If it was different." And so to be able to just feel the raw feeling and feel the sad or the anger or the fear, maybe not even connected to a story, but that has been kind of stored in your body, and to be able to release that, um, and being able to experience that and then know that your brain is capable of that often translates into you being able to retain that ability in your sober life. And then kind of on that same track, another common experience is like being able to feel love or feel cared for or feel cared for others or feel connected to others in a way that people haven't been because that protection
Mm.
that keeps you, from not being drowned by your feelings also prevents you from being able to connect with other people fully, connects you from being or prevents you from being able to feel the love and the vulnerability and all that stuff. And so letting down those defenses also lets that in. And that can be a really powerful experience for people to be like, oh, I am capable of feeling love. This is what it feels like. Now I want to look for that in my regular life. Now I want to strive for that or create a safer container in my regular life so that I can feel that more regularly.
Yeah, that's cool.
Yeah.
Yeah, that's a great way of saying it. Like, this, like you feel you release the emotion separate from the story. So it's just the raw experience of the emotion without the like fear of experiencing it, like yeah. It's kind of like this grief dumping that you get,
Yeah.
like
Yes.
you clean out your house and you put it all in donation bins and you just kind
Yeah.
of,
Yes.
um
Yeah. Yeah. Exactly.
yeah. That's beautiful. Yeah. I know too, like research has shown it increases like the personality metric of openness to experience, like permanently.
Mhm.
It's
Yep.
kind of this, yeah, which is kind of connected to like intelligence, creativity, but also connection. Like there's less
Mhm.
inhibition and story. You're less trapped in the story and those like well-worn paths,
Yep.
you know?
Yep. Which then very linearly connects to an increase in empathy,
Mm,
which then allows you to have more compassion for yourself, for others, to be able to connect more, to be able to like understand other people's struggles. You're like less intolerant.
mm,
That's the facet of psychedelics that people reference when they say like if like all the world leaders took psychedelics, the world would be a way happier place, because it like helps you to see things from other people's perspectives and helps you to remember or realize maybe for the first time that we're all just humans out here like struggling and doing our best and having feelings and loved and being hurt and all of that. And like we're all, if you can remember or remain connected into the fact that like there's more similarities than there are differences, then suddenly a lot of the like world problems feel silly.
mhm.
Oh, we're all just out here hurting and loving and trying to take care of ourselves and each other.
Yeah,
So
like that raw human emotion, like when you feel it, you recognize it in others and maybe our
yes.
stories, like there's an infinite amount of stories, so maybe that keeps us separate.
Yep.
It's like, well, I'm different from you because of this particular detail, even though maybe it's kind of the same,
Yeah.
which kind of keeps us siloed. But if when you really understand sadness or happiness or joy in your body, and you can recognize it in others, like, oh, this is just,
Hmm.
yeah. That's one of the elements of self-compassion is the common humanity idea of like, this is something that all humans feel, no matter how rich, poor, privileged, we have
Yes.
these emotions that run through us.
Yeah.
Yeah.
Yeah. And that's like that's a big part of what is not talked about in our regular society because it's not productive
Mhm.
or it's not encouraged or it's like weak or whatever, but it's a big part of it, and I think that contributes to us all feeling like we are alone in these experiences.
Mm.
If we
Mhm.
all felt more capable, more comfortable, more confident, more safe to be able to say like, "Oh, I'm a person and I'm having these feelings," then we would all probably feel less alone in that experience.
Yeah. And if you say that to somebody who is comfortable or can provide a container for their own feelings, they can provide a container for yours. Like, a lot of the time, empathy like, moments of empathy can be missed when somebody, like, doesn't really wanna feel it, because empathy is ultimately kind of feeling or letting in another's experience. If I don't really wanna feel that, because 'cause I'm uncomfortable with it, I may invalidate you or dismiss you or,
Yes.
and
Yeah.
create, like, a chasm between us, which
Yeah.
isn't helpful. Yeah.
Yeah, totally.
Yeah. What happens when okay, so now, like, the negative. Like, what
Mhm.
when you see people who are worried that their brain is broken or maybe they had kind of an irresponsible journey or with
Mhm.
somebody that wasn't trained, like, what kind of things like, what are the risks that you've seen? Yeah.
Yeah, there's a few, different facets there. The biggest risk, I think, is the, like, emotional, mental dysregulation piece, and that's often what the, like, "My brain is broken" piece is. Um, and that, I think, comes from a combination of things that in the patients that I've worked with that have been through that experience, it's often that they were not in a like safe or regulated or grounded or nourished state to begin the treatment. And so like the patients that I'm thinking of were like they had been burnt out for decades and they were like had recently gotten over like really significant illness and were feeling fairly dysregulated in their day to day, and then poorly trained or untrained therapist in quotations um, says like, oh yeah, well, this will solve all your problems. And so they encourage the patient to come in before they're ready, before they're like physiologically ready, before they're mentally ready, and then also sets them up with a whole bunch of unrealistic expectations. And that then puts their nervous systems and their physical bodies in a position to be very depleted, to be very dysregulated. Like these experiences are taxing. I
Mm.
think it's a thing to recall, and especially the longer sessions. Like ketamine is a shorter session; it usually is like 2 hours in entirety, but it's a draining experience for your body. Psilocybin is like 6 hours. Ayahuasca is like 8 or 10 or 12, depending on where you're doing it and how long you're doing it for. And so these are not it's like you're like running a marathon that whole time. And so if you think about like, is this patient fit and ready and has the capacity to like go and do a really hard, laborious task for 12 straight hours, that kind of gives you some idea of like, is the foundation laid for this to go well or not?
Mm.
Uh, and then I think the other big mental emotional risk is that, like we've talked about already, often psychedelics can open doors to big feelings or big memories or like realizations about traumatic pasts that you've had, traumatic experiences that you've had in your past. And I think that there's a handful of well-intentioned underground therapists who haven't been properly trained in trauma or in what happens when people get really dysregulated or their sense of identity gets really disconnected or threatened. Um, and then those people have the really scary experience of being like hit with all of this awareness that they didn't know about, like memories of stuff that happened or connections about like, oh, I've been avoiding thinking about this because it was too scary and now I'm being, faced with thinking about it. um, Paired with a therapist who doesn't know how to meet them there and hold space for them or how to carry that back into their regular life. So then they feel this compounding, like, I'm really overwhelmed. I don't know how to handle this. And I'm alone in that experience. And then the nervous system understandably responds with like big fear responses in those moments. So then you are flooded with all of the hormones that try to keep you safe, and you're just like on a crazy high alert and you end up in a like perpetual state of hypervigilance. So that's like a common outcome. You're not sleeping, and then that's all compounded that you're not sleeping, you're not eating, your hormones are dysregulated, and then everything just kind of snowballs.
Mhm.
um, and I think so that's like yeah, I've worked with a handful of people who've been in that position, and it just takes time for us to help them return to and like rebuild safety in their body, and then also understand the patterns that they were living in before they did the session that maybe perpetuate or contributed to this that they didn't even realize. And so it's like a process of healing from the experience itself, but then also like rebuilding new patterns, because we don't necessarily even want to go back to what they were like before. We want a healthier version of that.
Mm.
Um, and I think I would be remiss to not mention also like some of these, some people have more risks than others for these things to trigger like other um, psychological disorders. And so certainly a properly trained psychedelic assisted therapy program is going to really assess like your medical history, your psychological history, your family medical history. Not all of these things are safe to take depending on the medications you're taking. And so there's definitely some risks there. And then there are some physical capacity risks, like you have to have controlled blood pressure. So you could be on medication or you have regular blood pressure, but if you have uncontrolled hypertension, all of these medications temporarily increase your blood pressure like they would if you were doing strenuous exercise. And so that needs to be a thing that we're cautious of. So there's some like purely medical side um, precautions that need to be taken as well to make sure we're not hurting you in any way or interacting with medications you're on or putting you at risk for, you know, bipolar mania or anything like that.
Yeah, that makes sense. Yeah, it's like a kinda underlying predisposition or like,
Yeah.
you know, risk factors or family histories even. Um, and then, yeah, this kind of like physical stability and how, what are the structures that are in place in your life? Like, you
Yes.
know, It's like, all of a sudden you discover like my job is intolerable, my life is intolerable, my relationship, like, but I have
Mm.
nowhere now to go, no safe place to land. Like, how do I cope with my daily life as I figure out how to transition, or like all of these things?
Yes,
Yeah.
exactly.
Hmm.
Yeah.
Yeah. And then you mentioned too, yeah, I know we talked about kind of like maybe traumatic experiences that people don't really remember. And sometimes people have the experience of like, I know with some ayahuasca stories I've heard, people have talked about like I was kind of in my childhood watching it like a movie.
Mhm.
That could be amazingly therapeutic, but and we'll probably talk about this when we talk about trauma, but it's not always that. There's a time and a place to kind of revisit memories, and maybe you don't want to revisit memories at all. And so there's a lot, yeah, there's a lot there for
Yeah.
yeah. Hmm.
Yep, and that's a good example. Like, I would say, like, if a person came to me and they said, "Okay, I wanna do psychedelic-assisted therapy, but I wanna make sure I don't revisit any memories from this one time in my childhood," I would say, like, "Okay, you're not ready yet. Like, this
Mm.
is maybe not the right tool for you, at least right now, because we can't control
Mhm.
what happens in that experience, just like we can't control what happens in life." And so a lot of the work is, like, making sure, like you said, you've got
Mhm.
support systems and mechanisms in place to help you manage whatever comes up.
Mhm. Yeah, so it's like, okay, like, yeah, we don't know what will happen, but we can't necessarily, yeah, like you said, have an expectation of what will happen, but also have kind of a boundary of what I don't want to experience. It doesn't exactly work like that.
Yeah. And there's a lot of variability with dosing and with medicine, and so, it's, I know people talk about ego dissolution in psychedelics a lot, and that you have to, like, work hard to get to the ego dissolution place, and so, I would say most psychedelic experiences don't involve, like, true ego dissolution, and so you do retain some you know who you are, you know where you are, you have some connection to, like, and everybody's got a different experience and the medicines are all different, but there are definitely a lot of opportunities in there for you to be like, I'm not sure I want to go there," and so you do have some influence, but we can't guarantee it.
Mhm.
And also, there is some it's worth discussing, like, the things that you explicitly don't want to look at are it's like, don't think about white elephants, like, that's where your brain is gonna take you a lot of the time, probably for good reason, because there's stuff there that's worth looking at and then metabolizing and moving through,
Mhm.
uh,
Yeah,
if
if you're
and when you're ready.
consciously, like, suppressing, like
Yes.
a closet overflowing that, like, I know it's there, I know I gotta
Yep.
deal with that, it's yeah.
That's exactly the analogy that I use, yeah.
Yeah, it's almost like, though, I think the gravitation towards psychedelics I I is kind of like the person's like, "Okay, I kinda do wanna open that closet, like,
Mhm.
I'm ready.
Yep.
I'm scared, but I'm ready," otherwise
Yes.
I,
Yep.
you know, probably don't wanna take ayahuasca.
Yes, agreed, yeah, and most people very rarely does somebody come to me and say, like, "I wanna do this, but I don't wanna look at any of this stuff."
Mhm. Yeah.
Yeah, it's very much like, "Okay, I don't know how to look at that stuff, but I know that there's probably something in there for me, and so I'm ready to
Mhm.
explore whatever that is."
Hire, like, a closet organizer.
Yeah,
They
exactly,
can
yeah.
still watch and be like, "No, no, don't throw that away. Okay, actually, fine. You can take
Yeah,
it."
and
Yeah.
that's the analogy for trauma recovery that I use all the time is like, "Hey, you've got a closet in your basement that you've been shoving stuff into."
Mm.
No judgment, but, like, that's been your coping mechanism. You're like, "I can't deal with this right now. It's going in the closet."
Mhm.
And that's been happening for, 5, 10, 20, 30 years, and now the closet is so full that you have to spend all day leaning on the closet to keep the door closed, and so you're living your life with, like, one hand and maybe one leg.
Mhm.
So because 'cause you're just, like, using a lot of your energy to keep the door closed, and so the process is like, okay, we open the door, we let 6 things tumble out, we close it again, and then you and I together work through and learn how to deal with the 6 things that tumbled out, and for each one, you're, like, Marie Kondoing your brain sort of. You're, like, picking each thing up and holding it to the light and saying, like, "Okay, is this mine? Do I wanna keep it? If not, do I wanna get rid of it? Do I wanna give it back to the person that it came from? Do I wanna burn it?" And then also you have the question of, well, is there a hole that is left behind by that belief or that paradigm? And what do I want to replace it with? And
Mhm.
just like go through that process slowly over time until one day you can open that closet and look in and walk in and like it's all organized and there's a bin. And every now and then you're like, okay, I'm going to take down this childhood relationship with my father bin and like figure out what's in there, but it's more organized. You have more say over when it happens and how it happens.
Mhm.
And that's where people start to like gain the experience of being in control of their emotions and of their life. Is like it doesn't make the past go away, but it teaches us how to work with it in a way that feels like we get to be in charge.
Yeah, that's an amazing analogy actually, because, you know, like I can picture the person kind of like one arm and a leg leaning on the closet, and then the other arm is your job and your kids and your daily
Yeah,
life. You're like, why am I so exhausted? Why am I so burnt out? Why am I so overwhelmed?
exactly.
And then when you sit down with someone like you, like a therapist, a naturopath, and you're like, okay, now with my free hand, though, I'm gonna sort the six pieces that we let out. So
Yeah.
now, this kind of describes the type of context to enter into trauma work with, where it's like, can you use that hand, or are you using it to like keep
Mhm.
things afloat in your life, right? Like, can you
Yep.
kind of is there a container that you can, yeah, you have, therapists and support to help, but your free limbs are kind of engaged now in like
Yes.
doing this work. But eventually, you don't have to be pressing on the closet because stuff kind of stays in there, so you can walk away, and now you have your full
Yep.
capacity to, you know, enjoy and engage with your life. But
Yep.
in the meantime, yeah, there is kind of this like not checking out from life, but like there's time and energy that needs to be kind of
Mhm.
allotted to tend to it.
Yep. Yeah, you're not able to be fully present in your life because you're spending a decent chunk of your energy either keeping that door closed or dealing with the mess that happens every time you step away from the door.
Mhm.
So, yeah, it is a thing that I say often in the early days of trauma recovery work is like, this is unfortunately and through no fault of your own, your next full-time job. And now
Mhm.
you have to figure out how to balance your actual full-time job and your responsibilities as a parent or a partner or a whatever, and also doing this work. And that determines the pace of recovery a lot of the time because we can't always do all of that.
Mm, mhm,
And so that's where a support person or multiple support people, therapist, coach, naturopathic doctor come in. That's also where medication and supplements and optimal diet and nutrition come in to help like give you the most capacity that you have potential for in that moment so that you can put more effort into that if you want to.
mhm.
But
Yeah.
this is also why I don't have any judgment or anything but like respect and compassion for people that don't want to do this work because it's really hard
Yeah.
sometimes and it takes energy and capacity and not everybody like it's a privilege to be able to do this work. If
Yeah.
you are drowning in like, you know, food insecurity or paying your bills or keeping a roof over your head or being a single parent, that might not be the right chapter in your life for you to be able to do this because more important stuff is
Mhm.
taking your attention and your effort and your capacity.
Yeah, like, if that free hand is, like, keeping you alive, essentially,
Yes.
yeah, then yeah, you need it. It's not the appropriate time right now, and,
Mhm.
it's interesting because as we're talking, like, I think of many psychotherapy clients, often with who are kinda neurodivergent, and they're like they come in, they're like, "I'm burnt out, and I'm just kinda in this, treadmill with work. Like, I'm behind, I'm overwhelmed, blah, 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 blah," And so when we do kind of just, like, almost like solution-focused stuff, and we help, like, build skills and manage the day-to-day overwhelm,
Mhm.
you know, systems, stuff like that. That's often when now we go down and it's like, "Okay, actually, no. It's my father, it's my mother, it's my, traumatic past, or it's, my core beliefs," or like, it goes deeper. It's like once we've kind of addressed that initial layer
Yeah.
that was sucking all the energy, now there's room to address the contents of the closet.
Yeah.
Um,
Yeah.
yeah. But yeah, when you're managing things with one hand, again, like, it's a great analogy because there's a lot of compassion there. It's like, well, no wonder you're overwhelmed and it's so
Yes.
hard for you to, like, have your inbox, like, at 0 and not be kind of
Yeah.
flooded all the time and, like, not be behind in all these deadlines because you only have one hand to manage everything.
Yeah.
Hmm.
Yeah, exactly.
Hmm. And then what's the integration like? So after someone's doing psychedelic therapy, like, how many sessions is it usually? I know that can obviously vary, but
Super variable. Yeah. So in the literature, like in the research that we have currently, usually it's you have an integration session that day or the next day right after the medicine session, and then 1 or 2 weeks later, and then kind of ongoing with your own therapist.
mm,
Um, and so there's a various things that happen in an integration session, like, and it depends a lot on how new you were to the experience. Like in early days, for people who've never done psychedelics before, often a lot of the integration is just talking with somebody and sharing your experience to be like, well, that was a crazy experience. Like I've never had an experience like that before. Um,
mm,
the
mm,
the to be able to like be validated and seen with somebody that also has been there and understands what it feels like to be in that the terminology that we use in the literature and in the academic world is a non-ordinary state of consciousness, so NOSC, which can be also accessed via breath work and some forms of meditation and that kind of stuff. But it is an altered state and it is a wild experience, and so it's difficult to talk about if you haven't experienced it before. So that's often a little bit of what happens. And then there is sharing about the revelations or the awareness that you have, come to realize or come to experience. Or sometimes you take the medicine and like nothing really happens. And then you are like at least in your perception. Um, and so then you are processing and metabolizing the feelings of like frustration and disappointment and curiosity and like, did something in my brain change? But even though I didn't feel the medicine and all of those things. People that have been doing this work for a while talk about how like the integration session is like 6 to 12 months long. So it's kind of like laughable to say like, oh yeah, it's 1 to 3 sessions, because what actually happens in the integration happens over time as you've adopted a new perspective about yourself or the world or belief or whatever. And now you have to go through slowly the experience of living your life through this new lens and be like, oh, wait, well, how does this change the way I handle conflict with my partner? How does this change the way I handle feeling underappreciated in my job? How does this handle, like, and it's that same kind of like Marie Kondo effect of like, well, I have to pick up every piece of my life and figure out, well, how does this change that? And
mm,
that takes time. And the cool thing about all of the work that I do is like it doesn't require, you don't have to sit down and do that consciously. Like you don't have to journal about every single part of your life and this new belief system. A lot of it happens in the background, like in the default mode network controlled stuff that just is like happening as you're living your life.
mm,
Um, as long as you're committed to curiosity and like paying attention to what is changing and noticing what's happening in your body and in your mind, you'll be able to see the changes that happen over time.
mm, mhm. That's really cool. Yeah. Yeah, like it takes a while to like kind of encounter the moments that you're maybe watching for, or like, okay, the next conflict with my partner, what changed, and to
Yeah.
kind of be, oh yeah, aware of how these changes happen. But yeah, like and like making meaning of the experience can take time too, right? Like what does it mean? How does that weave into my narrative?
Yeah. Yeah.
Structures.
Exactly. Yeah.
Mhm,
Yeah, and then, like, maybe you have a perspective of like, "Oh, I am worthy of love,"
mhm,
or "I am deserving of being cared for." And so then you have this new belief, but now you have to go through each part of your life to be like, "Well, how would that change all of the ways in which I interact with this life?
mm,
And how can I ask for more?" And so then you have like, okay, well, you have a sit-down conversation with your partner and be like, actually, these are the things that I would like to be receiving from you in order to feel more cared for." And then you go through, that many step process with your partner to update the systems and the ways you're caring for each other. So like it's a big ripple effect and it takes time.
I think I've told this story before, but I remember my own experience where, like, after a experience with a medicine, I was walking in the forest, actually, and I passed somebody, and I saw this kind of, like, judgmental or kind of contemptuous expression on the person's face, and I
Mhm.
remember distinctly feeling like, "Oh, they made an expression on their face. And it was this first time, like really embodying this feeling of, oh, people's crap doesn't always have to do with me, or
Yes.
but how does that then, how do I act that out in my life now? Like, how do I bring that awareness to, you know, I mean, that's a clear interaction. I don't know that person. They're just walking by. What did I do? Like, so cognitively, I know that it doesn't have anything to do with me, even if that little schema is running.
Yeah.
But when somebody is unhappy with me, or I am in a conflict with someone, how can I bring that into how do I work with that, or what replaces that schema, or how does it
Yes.
become modified? Because sometimes it is about me. Sometimes I did screw up.
Yeah. Yeah.
So
Yeah. Yeah.
yeah. So what's the more balanced thought, I guess, in CBT language? And so that can take a lot of time.
Yeah, for sure.
Yeah.
It is a process. And I think that it is a gift to be able to give yourself time to process all of that.
Mm.
It's like and it's a recognition of that the medicine isn't doing the work, you are doing the work. The medicine just kind of like showed you a door that you didn't know existed. You get to choose if you want to continue to keep that door open or walk through that door in your waking regular life.
Mm. It's so cool. Yeah, it's a really fascinating area. Like I've always been kind of interested in it because of the kind of pivotal way that it can really like
Mhm.
accelerate. Like it's very hard to like build those different neural pathways when you're stuck in this same groove, and you just
Yeah.
you know like often there's a lot of intellectualizing and a lot of like the cognitive
Yep.
changes that can be really really sticky, but there's something about embodying the feelings and just seeing that as a truth that kind of hits you, that can be really powerful.
Yeah, for
Yeah,
sure.
like you said, seeing another possibility or another perspective and really seeing it, not just like, oh yeah, I can use my imagination and kind of see
Feeling.
how, yeah, like I know it
Yeah.
on a level that's deeper than just like, I wish I knew this. I wish I believed this, but I don't know. It's hard for me,
Yeah,
you know? Mhm.
totally. And that for that reason, the primary modalities that are used in psychedelic therapy and psychedelic integration are generally somatic
Mm.
work and like internal family systems parts work and like mindfulness and the where those three all overlap, which is like polyvagal theory and all of that stuff.
Mm.
Um, because it's not really about the cognitive understanding. It's about the somatic felt sense of like, oh, I know that I'm deserving of being respected or cared for, but I feel it
Mhm.
now. And being able to feel that is the thing that's going to enable you to like enact a boundary, or ask for more or decide that you want to make a different choice. It's not the cognitive knowing that drives behavior a lot of the time,
Mhm.
much as we
Yeah.
want it to.
Yeah, and I think that's, yeah, a good approach to trauma work too for most people. Like, I know that CBT informed trauma therapy is like the gold standard because it's easy to study it.
Yeah, exactly.
But
Yeah.
mostly when you talk to people, they're like, the real movement that I experienced was
Yeah.
IFS, internal family systems, somatic therapy, where I really like, EMDR, like where I really was able to kind of locate these parts in my body and metabolize them. Because a
Yeah.
lot of it's not verbal and not cognitive and not a conscious decision, you know?
Yeah, exactly. And also the like analytical conscious brain
Mhm.
often gets in the way.
Mhm.
And so that's like a thing I've seen in CBT many times, both as a patient and like when I was the patient, I mean, and in my patients now who've come to me from CBT is like the talking about the trauma or about the patterns or about the belief systems, like reinforce them or keep you stuck in those patterns. And there's like no way to talk your way into something you've never felt before. You
Mhm.
have to experience your way into something you've never felt before, and that's just not a framework that CBT holds. So, it's a useful set of tools, and I don't think it is an all-encompassing trauma treatment because it doesn't really get anything, like, below the head, so to speak.
Mhm. Yeah, that's a good way of describing it. Like, you know, write out your beliefs. Why do you believe this? Is there another way of thinking about this? That's a good skill. Sometimes it's the first layer, like to introduce someone
Totally.
into therapy. Like, oh wow, my thoughts. Like awareness of self-talk is
Yep.
really useful. Challenging self-talk. But yeah, it's a lot of people who've experienced trauma are caught up in ruminative cycles,
Yep.
So
Yeah.
it's like all in the head. Um,
Yeah.
yeah, I guess that brings us to like, how can an ND support someone who's experienced trauma? Because
Hmm.
yeah.
Yeah. So there's a few layers to that. The place where I always start is an assessment and a shoring up or a stabilization of the foundations of health. So like what NDs are, functionally good at across the board is like, are you sleeping? Are you eating enough of the right nutrients at the right times? Is your blood sugar regulated? Are your stress levels even remotely manageable, sustainable? Do you have the ability to move your body? Do you have a support system?
Mm,
Those are the like five foundations of health from my perspective. And also they are like the bottom of your Maslow's hierarchy in terms of health. Like we can't do higher order
mhm,
healing, whether it's like regulating your reproductive hormones or healing your trauma, if you're not sleeping or eating enough, or if your blood sugar is super dysregulated, or if you can't leave your house or can't move your body in any way.
mhm,
Um, and it's a common thing that also comes up with medication because there's like psych meds are notorious for being mediocre in their efficacy. And I think a decent amount of that is because they're not going to do very much if you're not sleeping and eating.
mhm,
And that's it's such a brutal catch-22 because mental health stuff, especially when you are like in the throes of PTSD or complex PTSD, make it really hard for you to sleep and eat.
yeah,
And then people are like, take these drugs, and the drugs aren't working, or you're doing your CBT and you just feel worse and worse because you're taking the meds and you're going to therapy, but you still don't feel good. Or
yeah,
you're like, your functioning is even decreasing even further. And so I always start with
mm,
sleep and nutrition.
mhm,
And that looks different for every person. Sometimes it's like we run labs and we make sure you've got adequate vitamin D and iron and B12, 'cause common deficiencies that are going to contribute to mental health and your ability to be regulated in any regard. Sometimes it looks like, sleep hygiene, and sometimes it looks like medication to help you sleep better because if you are so sleep deprived and your sleep is so interrupted, we're not going to be able to do any of the trauma work. You're not going to be able, you have no chance at regulating if you're getting 3 hours of interrupted sleep a night.
mhm,
So we start at the bottom and we work there. And sometimes that's there's like a lot of education involved there because often people come to me and then they are like, okay, I'm drowning in trauma or I'm stuck in complex PTSD. Like, how do I get out of this? And I'm like talking about sleeping and what you're eating for breakfast. And it's important for me as the practitioner to make sure that they understand why that stuff is important and how it's going to help them to feel better.
mhm,
And I love starting there for in addition to that, like it is the prerequisite to everything else we want to do. I love starting there for two reasons. One is that so often when we start there, a lot of the symptoms that people are struggling with correct themselves on their own because the body has the innate capacity to heal when we give it the building blocks that it needs and we remove the obstacles in the way. And so
mm,
I think it's a very useful way for us to get out of the trap of like a supplement for every symptom
yeah,
or a drug for every symptom. Is like, well, when you sleep and eat and give the body its basic building blocks, half your symptoms are going to get better. And then the other half, okay, those are what we build a treatment plan for.
mhm,
And the other thing that I think is really important about that step of the trauma recovery work is that most people who have been drowning in trauma and struggling for long enough to come and see me have lost a lot of faith in their body and a
mm,
lot of trust and a lot of trust is broken between their body and their ability to interpret what their body needs. And I think rebuilding that trust or maybe building it for the first time that like your body is sending you messages and you can learn to interpret them in a way that allows you to take care of yourself and get to a place of happy, healthy well-being. That's a really important part of healing and of trauma recovery. And so if we help people to see, like I don't give supplements or medications in a lot of cases on visit one because people are so quick to attribute improvement to those things. But if all we did was we helped you to eat breakfast and go to sleep a little bit earlier, and then you feel, a 50% reduction in your anxiety, which I hear all the time,
yeah,
people are like, "Oh, damn, like, okay, this is
Yeah.
real." And when I take care of my body, it actually does feel better. And you start to like we get to start to build a blueprint for people of like, what are their baseline needs? This is the thing that you want to do every day for the rest of your life to take care of yourself. So we're empowering them. It's the, teach a person to fish thing. Like, I want them to not need me anymore. And this is part of how we do that, to be able to help them to understand, okay, what does my sleep and my diet and my supplements and my social support and my movement need to look like in order to set me up to be able to do that stuff? And how do we make that sustainable for people?
Mm, I love
That's where we
that.
start.
Yeah. Yeah, it's like, yeah, I know we said before we recorded, I'm like, let's talk about like mental health and what NDs do because it is my focus, but you lose yourself in the weeds as you're talking about the specifics and the extra things and the cool new therapies or the angles.
Yeah.
And what is really beautiful about naturopathic medicine, this is like the topic of a new Substack I'm working on, but like we're really the biopsychosocial,
Yeah.
you know, um, me model, like,
Yes.
because and a lot of people will kinda get that biopsychosocial from various practitioners, but an ND is really like, that's what holistic means ultimately,
Hmm.
and yeah, like, so many like, in my psychotherapy practice, see a lot of people who I'm like, there's probably a blood sugar dysregulation here,
Yeah.
and all the talk therapy in the world or somatic work is
Yes.
not going to fix that, you know? It might help you understand you need to eat or, like, what to
Yeah. Yeah.
eat,
Yeah.
but a lot of the time with that, like, being tired and needing to regulate your blood sugar, like you were saying, there's sometimes a disconnect in that biofeedback of really even understanding what those signals mean or what those cues
Mhm.
mean, especially if that hasn't been built in when you were a baby, like, the inner child kind of needs that
Yep.
safety and that reconnection with, like, talking about, like, IFS, like, the different parts and
Yep.
how do we take care of ourselves, recognize what it feels like to be tired, it's time to go to bed, even if you might also be kind of wired or
Hmm.
um, procrastinating when it comes to sleep, like revenge bedtime procrastination, or
Yeah.
you're so hungry that you don't really feel hungry anymore. You just feel anxious and almost nauseous. So you don't really think that food would help, but then you develop this relationship with yourself where it's like, oh, actually, that's when I should eat.
Yeah.
So there's a lot of these pieces of like how do we learn how to take care of ourselves?
Yeah.
Um,
Yeah. So it's all of that, and it's all of that through a trauma informed lens, which means
mhm,
that we're approaching all of this without judgment,
mhm,
and we're building a plan to help those pieces get accessible for the patient at whatever pace works for them.
mhm.
The understanding that a lot of people will come to this point, like, they know that they're not eating well and they know that they're not sleeping well. And if this, like, if all they needed to do was to have somebody tell them to do it better, they would have done it already, right? So
Yeah.
there are things that are blocking them from being able to make those changes.
Mhm.
And so that's why I really like getting to wear multiple hats under one license, because my coaching clients are also my patients. And so we can like jump back and forth for me to say like, okay, like let's maybe do a coaching session here where we talk about the parts of you that are resistant to taking care of yourself,
Mhm.
or to explore why it doesn't feel safe or even accessible to listen to the signals that your body is giving you.
Mhm.
And then we can jump back in to the naturopathic work and be like, okay, now that it feels a little bit safer for us to even talk about what you're eating, or to be able to even give any attention into how you're making food for yourself, because it no longer is like going to trigger a full disordered eating flare or whatever. Okay, now we can talk about, yes, you need 30 grams of protein at breakfast and you need to have that before caffeine, and, all of those things. So it's like a back and forth of that. Um, and then also compounded by an awareness of how many people come here for this work with a history of being really mistreated or dismissed by other medical professionals, like the medical trauma layer. It's
Yeah.
really common in women, especially, and in mental health patients, and in like, people in bigger bodies, or people that aren't straight or that aren't monogamous or that aren't, like, that don't fit the standard,
Yeah.
white, straight norm, basically,
Yeah.
skinny, all of those things.
Yeah.
Uh, And so it's like building a therapeutic relationship and a relationship with themselves to be able to make those changes,
Mm-hmm.
to make them accessible and to make them sustainable. And like, yes, you and I could talk forever about like the herbs and the supplements, and I'll give you my 10 cents on psych meds because I think that's a really cool layer. But so much of it is the foundational piece, but just really like taking our time
Mm-hmm.
in the foundations to be able to make it feel possible for people.
Yeah, that's a great point. Like, right, because there's sort of the like I'm very resistant to the idea of like protocols, even though
Me too.
it's but sometimes like these courses or packages like kind of they can be accessible to people, right? When you do your own research and go to ChatGPT and here's but there's a lot to the art of like, okay, yeah, sleep, breakfast, you know, but how does that look like? Like, what does that look like for the particular person, right? And
Mhm,
how much time do we need to just spend on psychoeducation and like letting them like kind of helping match the symptoms to that or letting someone talk and express what they already know about their sleep or what their obstacles are, what their difficulty is, or um, yeah, like looking at like the IFS. Like, there's a lot of stuff that comes out around lifestyle changes, around like the inner rebel and then the inner critic and their
yes.
dance. And sometimes people will describe that like, I know I need to exercise. I really want to exercise. I have so many values that are connected to getting stronger, longevity, but I just can't do it. And then we often discover that there's a rebel that's trying to stand up to the critic who is
Mhm.
like, yes, you
Yeah.
have these values, but the critic is also kind of shaming you. Why aren't you
Yep.
living up to your values? What's wrong with you? And then there's a rebel that's like, no, I don't want to live this way. Like, I don't want to live under your rule. And so kind
Yep.
of, yeah, like looking at that, you might not see any change on the surface. You might not be lifting a weight for many months as we kind of tease that apart and understand
Yep.
it.
Yep.
Um,
Another one I see often there in that realm is people that have all those values but are really resistant to doing the work because they didn't get cared for in the way that they deserve to as a kid. And
mm,
so there's a lot of resistance to being like, I've been caring for myself my whole life.
ah,
It's like not fair that I have to do even more to get myself out of this hole that got dug for me by trauma that I experienced as a kid. So there's like a lot of grief work often to be able to sit with like how shitty and unfair it is. Like, yeah, that sucks. And it's okay that you really don't want to do this work right
mm,
now,
yeah,
and how can we make space for that and allow you to feel and metabolize and process those feelings of like, yeah, it's not fair that you have to do all of this work on top of all the work you've been doing already to get yourself here.
that you're still having to do this. Like, you've been adulting since you were 5,
Like,
and
yeah.
yeah, I can see like there's you know, without kind of really understanding or unpacking that layer, sitting in front of someone who even compassionately or, benevolently is like, okay, like, let's like, eat protein at breakfast. It's like, here's
Yeah.
another thing I'm doing wrong. Here's another thing I
Yes.
have to do. Like, feeling that burden of like, okay, so I've already been feeding myself, cooking for myself, planning my own meals my whole life, but now you're telling me that I have to fix it even more. Or there's something that I wasn't like, yeah,
Yeah,
totally.
exactly. Yeah. And so like my stance on that is like there's no such thing as a non-compliant patient, only
Yeah.
a practitioner who is missing a piece.
Mhm.
Whether that's education or compassion or the trauma layer or the resistance or whatever. But
Mm.
yeah, it's all of that for
Yeah.
sure. Yeah.
For patients listening, you can come back if you haven't done anything. Yeah, a lot of the
Totally.
time
Yeah.
people will say like, "I've been wanting to come back. I haven't been feeling better, but I'm just worried because I didn't do the thing you said." But that's a amazing opportunity because especially when we're getting to know somebody, you can say like, "Okay, like sleep, let's work on getting to bed 30 minutes earlier. Let's come
Mhm.
back." And then we often don't know what the obstacles are until we try.
Yep.
So that's a good opportunity to come back and be like, "Hey, look, I didn't do it. And I wanna understand. We can work together to understand why," you know?
Yes. Yep. Yep, and that's the thing that I now, like, build into my patient communication, especially after a first visit. I was like, "Okay, here's what we're gonna do in the second visit. We're
Mhm.
gonna check in on all these things that I've suggested for you, and if they're going well, this is what we'll do, and if you didn't none of them, this is what we'll do." And
Mm.
so that they can know, like, there is space here, it is safe here, I'm not gonna be, like, chastising them. And that's part of a trauma-informed practice is to, like, really be very transparent with your patients and with your clients about what's happening so that they are not going to be scared or not going to be surprised or not going to be blindsided. Because trauma is, like, ultimately about having your agency removed.
Yeah.
And so if we can give people back their agency, it's a big part of the healing process.
Mhm. Yeah. And I'm glad that you brought up the medical trauma piece because I think that's huge, right? Like,
Mhm.
I remember talking to a friend about this, and she was like, "I just can't take I can't take a supplement or an herb that's recommended. There's something about just, like, having you be like, 'We should try, like, Melissa, the herb,' that
Yeah.
just feels like I don't wanna just take advice when it's given to me." Like, there's an immediate kind of, defense that comes up. Like, I need to maintain my own agency, so I can't, I'm so used to just being told what's good for me or what's gonna happen,
Mhm.
and I thought that was really interesting and very self-aware of her, and, we don't always have that kind of, like,
Mhm.
awareness of when it's happening, but yeah,
Yep.
yeah, like,
Yeah, but
allowing people yeah.
if you've got a patient that comes back and they say like, "Okay, well, I didn't do any of the stuff that you said," like, you can either approach that from like, "Okay, well, what now?" Or you can get
Mhm,
curious, like, "Hey, let's explore why that felt inaccessible for you,
mhm.
and let's spend time, like, working through that so that we can figure out how to make it accessible for you."
Yeah.
Yeah.
The nice thing too about naturopathic medicine is there's so many herbs, supplements, angles,
Mhm.
ways to approach something I'm not an expert on this, but something that's always been interesting to me is when someone kinda has an intuitive sense around an
Mm.
herb or supplement, like one person was like, "I had a dream about this herb last night for some reason," like hawthorn or, and that's great. Let's go with that. But sometimes people are like, "I just don't wanna take iron, I don't know why." Like, I know it's good for me, I know and so to be able to trust that and allow that can also really help build someone's self-trust and agency, and then the therapeutic relationship of, "Okay, don't let's not
Yep.
take iron, let's go somewhere else with this,"
Yep.
as opposed to, like, yeah, fighting or doubling down. Like, there's a million other ways to
Yep.
maybe get iron, or maybe there's something else that needs to happen
Mhm.
first, and our body is so complicated that it isn't so linear, like, low iron, take
Yes.
iron, you know?
Yeah.
Um
Yeah, yeah, totally. The number one rule in my practice is no forcing.
mm,
Like, I am not gonna force you to do anything. I don't want you to force yourself to do anything, even if it's a thing I've told you you should be doing.
mm,
'Cause if you have to force it, it's a cue to us that there's resistance there that we should get curious about, and at the very least, if you're able to force it, it's not gonna bring about sustainable change.
mhm,
And because most of my patients come to me with a background of trauma and either come to me directly for trauma work or
mm,
for the physical like manifestations of trauma. I think the no forcing rule is like a very foreign concept for a lot of them because they've had to force themselves to do things for a long time. And also that rhetoric is really reinforced by society. Like, oh, you've got a headache, take an Advil, go back to work. Oh, you're tired, have caffeine, go back to work. Oh, you have your period, suck it up, go to work. Like forcing is like a part of our life because of capitalism and the patriarchy and all of that stuff. And so
mhm,
if we can start to and what it does is like it really reinforces that like you shouldn't be listening to the messages your body is sending you, and then over time that just dilutes your ability to even interpret them at all. So
yeah,
if we can really work back into a flow and a like reciprocal safe relationship with your body and its messages, and maybe it's no iron right now, and maybe 3 months from now they'll be ready to take iron, but willingly. And I would much rather us wait 3 months and then work into a plan that feels accessible to them because we're building these plans for life. And so like 3 months on the scale of being able to take care of yourself for the rest of your life is a drop in the bucket.
yeah,
But the alternative is that I like, force you or you force yourself to do this thing in spite of what your body is saying in this moment. That's going to fracture our therapeutic relationship likely. It's also going to further break the trust between you and your body, and it's not going to help you get better long term.
Yeah.
And so a lot of this is like a patience and an immense amount of trust in the inner wisdom of the person's nervous system. And that doesn't always mean that their dreams are right or their intuitive sense is, like, yes, that's exactly what you need, but it's coming from somewhere. And
Yeah.
to honor that and to work with that and to meet the patient where they're at, I think is really the key.
Yeah. Yeah. Like, I think, you really want to like honor someone's intuition and like how they're building that trust with themselves and their gut instinct. And,
Yeah.
um, it's not, I know better or this is the way because yeah.
Hmm.
I love that. Yeah. And I'm also thinking, how sad it would be if someone, because it takes a lot to finally reach out, right? Like many patients will say, like, I've been
Hmm.
thinking about this for 8 months, a year, multiple years. Like I've been following you, listening to podcasts,
Yeah.
and now I'm finally booking an appointment. And how sad it would be if there's a rupture that you know,
Yeah.
um, where the person's like, okay, like I need to be at a certain level of like readiness, or I need to like take this on wholesale if I am gonna get this kind of help,
Hmm.
as as opposed to being met where I'm at,
Yeah.
wherever that is. Yeah.
Yeah. I agree.
Yeah.
Yeah.
Yeah. What's the, you said you had something to say about, psychiatric
Oh, that's
medication?
segment. Yeah.
Yeah.
Yeah. Okay. This is my own personal little soapbox, but so in British Columbia, naturopathic doctors have a pretty broad prescribing scope, and so we prescribe most of the things that a GP can prescribe, or an NP, like a primary care provider, because we are primary care providers here.
Mm,
We can't prescribe anything scheduled, so like no opiates, no benzos, that kind of stuff. But all the psych meds are in our prescribing scope, and not that many of our colleagues out here are trained in them, so not that many people use them. But SSRIs are a common drug that lots of people use, especially GPs. Um, and I think they are a really, really useful drug and potentially life saving in a lot of cases. And they are often not well understood, and so then they are prescribed or misused in a way that perpetuates the stereotype of them. And so I think so the way that I use SSRIs and the way that I think they are best served or best serving the patient is to use them to support the expansion of the patient's window of tolerance.
mm,
Like it's like, you are leaning your whole body against that closet and you've only got one arm, and an SSRI like gives you a longer reach,
mm,
or it gives you a second arm, and it doesn't. So I think a common error that people make is prescribing too high,
mhm, yeah,
and it results in just like a numbing out, like a disconnection from the feelings. And for some people, that is what they want because they have no
mhm,
skill set or understanding of like why feeling their feelings is important or how that can be productive or valuable for them.
mhm,
And like it's not a criticism of GPs, like they aren't properly trained in this in a lot of ways as well. And so they just have their patients coming back saying, I'm drowning in my anxiety, and they don't know what else to do but to increase the dose. But I think the best and most effective dose is the lowest dose that you can get that gives you more capacity, that makes you feel like you've got a little bit more room to handle what life throws at you, that doesn't numb you out, that doesn't disconnect you from your feelings, and also doesn't, give you bad or uncomfortable side effects.
yeah,
But with my patients, like escitalopram or Lexapro is the most common one of the most common SSRIs that we use now, and the research as done by the drug companies suggests that the starting dose is 10 milligrams.
mhm,
And I start a lot of my patients, most of my patients, I would say, at 2.5 milligrams.
mm,
It's like a literal 25% of the starting dose of what's recommended. And most of my patients see benefit, and we get up to like 5 milligrams or 7.5 milligrams, and some they're at 10, and that's great. And I'm not at all opposed to people taking a higher dose when they need it. But I have a lot of patients that have a history of being on SSRIs, and they came off of them because they didn't like how disconnected they felt because they started at 10 or, an equivalent starting dose of another drug. And, it's just, the analogy I always make here is like, it would be about equivalent of somebody saying like, oh, I've got a really brutal headache, and somebody say like, oh, take ibuprofen 20 milligrams.
Mhm.
Like the minimum effective dose of ibuprofen is 200 milligrams in most people. And so if you're not familiar with that, you'd take 20 milligrams of ibuprofen, you'd be like, oh, that drug is stupid. It doesn't work.
Mhm.
And it was actually just not the right dose. And the same thing is true in a lot of drugs, but especially in SSRIs, which have just such a really bad rap.
Mhm.
Um, because I think they are often dosed too high.
Yeah, I agree.
Patient.
Like, yeah, I think I'm really happy that you mentioned that because I think a lot of the way that studies are designed, like you want to see an outcome, you want to see an effect, you don't want to do a really, really long study because that's very
Yeah.
expensive. And you're also gonna get like a placebo response in the placebo group that's pretty robust, especially with
Yes.
subjective symptoms like mental health,
Yeah.
You're not measuring blood pressure, you're not looking at like an MRI, like you're just how are you
Yeah.
feeling? Are you eating like so yeah, but what I totally agree. Like I think what I see very often, it's interesting that it's usually like I see this so much with Zoloft or sertraline
Mhm.
for OCD, which can be
Yep.
extremely crippling for a lot of people. That's not a good word, but like destabilizing for a lot of people, like caught up in like rumination and unable to function and just really trapped in those sort of thought loops. And very often like, okay, I'm trying Zoloft, first I think it's 25 and they're like, and that's great. That works really well. And then their GP is very often like, okay, so you're tolerating it. Okay, so we're going to 50.
Yeah.
And then they don't feel as great and the benefit isn't really there. And we often have a conversation around like, well, let's just stay at 25. But
Mhm.
maybe even better to start even lower and
Yep.
just see what's the minimum effective dose because there's,
Yep.
often a trade-off. Like the higher the dose, the more the side effects.
Yeah. Yeah,
Yeah.
exactly. Yeah, and I think, I end up starting with Lexapro often because it's a tablet, so you can cut it in half, but my patients, who prefer sertraline will just get it compounded, and then we do drop dosing to figure out whatever less than 25 milligrams is a good place for them to start.
Hmm.
Yeah,
Yeah.
I think it's a common misconception that the instructions that are determined in a study
Yeah.
are exactly how you're supposed to do it in your clinical community practice. And having, interacted with researchers that are running these studies, like they're out there saying like, no, this is not what
Mhm.
this is to determine safety and efficacy. This is not to determine best practices.
Yeah.
And I think that's a thing that's often overlooked. And like we could talk about how like you only have 5 minutes with a patient. And so you don't have time to think about like what's the best practice. You're just trying to do the best that you can in a really limited amount of time. Um,
Mhm.
in the conventional system, at least. So I understand the contributing factors, but I think there's a lot of art to prescribing.
Yeah.
And, and I think it's worth it to talk about it because these drugs, I have so many patients that it took them like 5+ years to get comfortable with taking this drug because there's so much negative rhetoric around taking SSRIs or taking any medication for your mental health stuff. And so many of these patients are like, "Oh my god, like, I have a life now. I wish
Mhm.
I started taking this drug 5 years ago."
Yeah. Yeah, it's a good point too to point out, like, how that might perpetuate a stigma, like,
Mhm.
also if, it's held up as, like, this is the first line treatment, this is if you have depression or anxiety, then you get one of these medications and that's kind of it,
Yeah.
versus and that is kinda how it's studied, right? It's like, we just wanna see what's the effect on, like, the GAD score for your
Yeah.
anxiety, like, is there gonna be an effect? And you'd probably have to prescribe pretty high to see something change.
Yep.
But I love that you talk about the window of tolerance. It's like, we don't wanna numb your feelings, we just wanna create a bit of softness around and expand. And for people listening, window of tolerance is sort of like, where you're regulated and connected to yourself, and above the window, you're, hyper aroused, and below, you're in a dissociative state or under aroused,
Mhm.
and, like, the work is kinda done within that window. So if you can kind of soften the edges and, like, open it up a little bit, then work is done inside of that, whether it's, like, lifestyle stuff or therapy, but that also implies that there's, like, other things that you're gonna receive in terms of treatment, not just the substance,
Mhm. Yeah, and like, one of the there are kind of a few main questions that I use to help people decide if starting medication is the right choice for them. And like we already said earlier, like it's almost never the place that I start. Like we start with all the foundational stuff. But one of the big questions is, do you feel like you have the capacity to add more things into your life in terms of supplements or therapy or practices or meditation or exercise or whatever in order to continue to work on improving your mental health right now? And or do you not have capacity for that right now? And in which case, sometimes medication is the right answer because it very quickly gives you more capacity. Like it expands your window of tolerance, which like allows you to it takes the intensity down off of the like high highs and the low lows. That's what the drug does. And then expanding your window of tolerance gives you more capacity to handle feelings and stress and tasks without getting super dysregulated.
Mhm.
And then another question that I use to help people make this decision is like, do you have, based on how you're feeling right now, do you feel like you could hang out here for another like 2 or 3 months while we build these practices and like get you to eat regularly and get you to take your meds and or take your supplements and do your workouts and do your journaling and go to therapy? Or do you feel like, no, I need to feel better yesterday or else something bad is going to happen? Then okay, that also helps us to decide what is the first treatment. And like you said, if I'm prescribing a medication, that's by no means the only thing I'm doing.
Yeah.
It's just the beginning of or like a step in giving us more capacity to be able to implement all the other things. And for some people it's this is a drug they want to be on for the rest of their lives. And for some people it's more capacity temporarily so they can learn how to do all this other tools and like ways of managing their mental health so that they don't need the drug down the road.
Yeah.
And like I've got no attachment to one outcome or the other. It's just how can we help you to feel better and get to the place you want to be?
Yeah. So it's like, yeah, true holistic kind of biopsychosocial
Yep.
prescribing of like, yeah, do you need immediate relief? And, you know, I mean, our style of medicine is quite active,
Yeah.
so if that and that's not always accessible for people, like, we're
Yep.
asking you to, okay, like, add some things and take some things, and that's adding more to your plate, so,
Yep.
if you're already squeezed, then, it may not be possible to add more things. Those are
Exactly.
great questions, yeah,
Yep.
um, and then a low dose is easier to wean off of,
Yep.
Yeah, uh,
Yep, and it's also, like, the slower we build even if we end up working up to 10 milligrams, if we do it slowly, then we're also in the process giving you more opportunity to get to know what your body is saying
mhm,
and to feel the changes and to as opposed to just, like, barreling through and, like, placing you in this new mindset of, like, "Oh, I'm not drowning in depression anymore." Like, well, actually, let's give you the opportunity to be present in that process so that you can really understand what it feels like as you start to feel lighter or feel things less intensely or feel more capacity, which is a part of, like learning
mm,
how to like I was the process of healing, especially in trauma, mental health, nervous system recovery stuff is learning to have a relationship with your nervous system. And you can't have a healthy relationship with anything if you don't speak its language.
yeah,
And and this is the part like we have and learning language takes time,
yeah,
and it also takes exposure. And so if we build that up more slowly, then we have a greater capacity for exposure to the signals that your body is giving you that you can then learn to interpret, and that strengthens your ability to speak to and engage with your nervous system and with your body in a healing, sustainable way.
mhm. Yeah, that's a great point, right? When you're, like, kind of titrating up very slowly, you can, like, watch the change, like, what do I
Mhm.
feel? As
Yeah.
opposed to, "Oh my gosh, I'm at 25 milligrams, this is, like, maybe
Yeah.
too high for me,
Yeah.
and it's, like, too big of a jump," and
Yeah.
mhm. Are there
Yeah.
other
And
Oh, go ahead, yeah, go ahead.
I was just gonna say, like you said, like some people are in such an acute state that they like that's not the time where we learn the language. Like that's the time where we get immediate relief. And so we don't have to do it slowly. We
Mm,
can do the slow on the other end as we taper down as well. So it's really it's about meeting the patient where they're at as opposed to just like applying a protocol to every patient universally.
yeah, it's like if someone's screaming at you in a language you
Right.
don't speak, you're like, I'm not gonna get my, like, book out, I don't know,
Yes.
yeah, like, do I need to get off the road? Am I, like, stepping on something,
Yeah.
Um,
Yeah.
mhm.
Yeah.
Yeah, so, like, I need to calm down or have, like, a more regulated state to be able to, like, start to interpret and learn the
Mhm.
vocabulary and hear the the syllables and, I was going to ask though if there are other, so for people who are very against medication, or for us Ontario practitioners that
Mhm.
don't have prescribing and can't kind of titrate doses, do you use other stuff that works in the serotonin pathway? Like, have you
Yep.
find that that's effective or yeah?
Yep. It works a little bit differently than medication, but for a lot of people, it's the right choice for various reasons. I use a combination of supplemental nutrients and botanical medicine. I like, lots of magnesium and higher dose EPA omega 3s and St. John's wort in really high doses, well, like concentrated doses, saffron,
Mm,
ashwagandha, theanine, um, inositol. There's lots of nutrients and a handful of plants. Hawthorn is a nice one for like the panic palpitations that
mm,
people feel. So yeah, there's a combination of things that I will use for sure. And lots of my patients don't want to be on meds or can't be on meds or,
mm,
were and had a bad time. And so there's like many tools that we can use.
mhm,
And a lot of it is also about getting really curious about, so what, like once we've established the foundations, what are the underlying drivers that are contributing to the anxiety or the depression? And like in some people, yes, it is just like pure, neurotransmitter biochemical imbalance, we think. But there are a lot of people for whom it's like, a histamine thing or a reproductive hormones thing or a menopause thing or a gut health microbiome thing or an inflammatory thing. And so it's also really a lot about like what getting curious about what are the root causes that we can influence from a more broad perspective.
mhm,
And that just generally also tends to work better, more sustainably, and gets us away from just like symptomatic management and the like they call in school they called it green allopathy,
right,
like
right, yeah,
prescribing a supplement for a symptom, which is like sometimes the trap that GPs or MDs can fall into as well.
yeah,
So
yeah. It's
it's
so
a
easy to kind of
balance.
yeah get wrapped up into like I just want to help, I just want someone to feel better, and you um the fixing part or the performance part wants to kind of like you know um yeah one of my most popular, like I made this YouTube video, I don't even know, 10 years ago, I don't know, about amino acids. I don't even
Mhm,
know, it's not even a good video, but it's so popular compared to my other YouTube. And it's just very interesting because like I always think, I'm like, what is so attractive about the idea? But I think, I mean, this idea of like, you're right, medication stigmatized, so people are looking for kind of an alternative
mhm.
based on that neurotransmitter idea, but also this, I just want relief. I just want to feel better, you
Yeah,
know? So I did a follow-up video saying like, yeah, they can be helpful, but kind of like a pyramid. I mean,
yeah,
you know, by the time that we're working on neurotransmitters, maybe we find that's not really the thing that's out of balance, you know? But
mhm,
I like the frame that you created of like, well, when do we start with foundations and when do we start kind of at the top of the pyramid to provide
yeah,
relief, you
yeah,
know?
yeah,
Yeah.
exactly. Yeah,
Yeah.
yeah, which is like functionally, it's are your symptoms the thing that is impairing you from being able to sleep or eat or take care of yourself?
Yes.
Okay, well, then we treat your symptoms first so that we can then down the road or 3 weeks or a month from now, start working on the foundations.
Mm,
But it's the same thing we were saying before, like, if you just
yeah.
shout louder at somebody that they need to sleep more and eat more, and that doesn't address the reason why they're struggling to do so.
Right. Yeah.
Yeah.
Yeah, like, we talk a lot about, like, vicious cycles, right? So where do you address it, and where do like, chicken and egg kinda cycles, like, where do you start with the chicken or the egg? And sometimes it doesn't matter, it's just about patient preference and what, they intuitively feel because, if you take a neurotransmitter to help with sleep and then you sleep better, well, then now you're sleeping better, and then
Mhm.
that's addressing the underlying thing. Or if you're able to work on sleep, then you might
Yep.
regulate your neurotransmitters. So it's kind of just about where it makes sense to start. And
Yep.
yeah. Yeah, I love that collaborative aspect. I think, it can feel a little bit foreign for a lot of people that has
Mhm.
a practitioner that's like, "What do you," like, kind of turning it over to you and not just telling
Yes.
you what to do. I think a lot of people are like, "Oh my gosh, wait, I have to make the decision? I don't know what I need to do. You're the
Yes.
doctor." Like
Yeah. Yeah, and I ask my patient that question all the time. Like, "Hey, here are some options. Which path do you think feels the most accessible or the most aligned with you?" And yeah, often people are caught off guard. And so like sometimes I will walk them through like here are my thoughts, like here are the pros and cons. Here's how I would make that decision. But I think it's actually really important for us to give the power back to the patient. Like a lot of the values that I operate from in my practice is that to like minimize the power differential as much as possible. Like I'm not the boss. I also don't know what's best for your body more than you do.
Yeah.
And so but the world and the medical system, and especially if you're a woman, and especially if you've got any mental health challenges, has just told you over and over and over that like you have to outsource
Mhm.
everything to somebody smarter than you or with more letters after your name or with more power than you. And like that is part of the problem.
Yeah, totally. Yeah. I just had this conversation with a friend. It's a little bit of a non sequitur, but we were talking about societal pressure to like for women to have children. And
Yeah.
I'm like, it's like if somebody's like, "Don't you have kids?" And it's like, okay, let's like unpack this for a second. Like I would have to be the one to be pregnant, to deliver a baby, to care for a baby. So, you're telling somebody you need to take iron, but you're not the one going to buy the iron, taking the iron, swallowing
Right.
the iron, maybe feeling nauseous from the iron. So it's all well and good to give someone advice, but to actually have the burden of having to follow through and do it and be in the body
Yes.
is, yeah, that's something else. So yeah, to be able to like allow someone to embody their health experience again. Um, and information is so accessible that I think maybe that is helpful for the power differential a little bit too. Like a lot of patients are coming in with a lot of like kind of a massa confusa of information that,
Yeah.
you know, we're
As long as we are receiving it with grace and being like,
Mhm.
"Yeah, bring me your questions. I would
Yeah.
love to, like, dispel your Reddit myths or show you the data on why I think this is true." But conversely, if we're receiving that as an attack or a threat
Mhm.
to our ego or, like,
Mhm.
"Shut up about your Dr. Google," like, that's just gonna perpetuate the problem.
Like,
But
this is
yeah,
what
I
it says. Yeah.
yeah, but I that's one of my favorite things to do is like, yeah, bring me all the nonsense you find out on TikTok and we'll parse it apart. Here's
Yeah.
the evidence that I know. Here's the evidence that disproves that. Here's the question mark or the gray area that like maybe that's true, but here are the risks. Here's how you make that
Mhm.
choice. Because I think it's our jobs are evolving as the world around us
Yeah.
evolves, and I think part of like docere is the root, Latin word for doctor, which means teacher. And I think that's a big part of our job
Mhm.
is to give people the opportunity to learn how
Mhm.
to take care of themselves in the world that we are living in 2025, which now means how do you interpret media and
Mhm.
social media and all of the nonsense that's out there, and how do you figure out what's right for you?
Yeah, exactly. Like the common, I'm sure you get questions. I get questions all the time, and the answer is always it depends because
Yes.
there's a reason that the intakes are an hour and a half. It's like we got to
Yep.
sit with everything and go through it. And but another thing I really love is the the broad spectrum of being an ND is that I don't feel beholden to any or in love with any particular therapy. Of course, I have my biases, like we all do, but I'm okay with killing off darlings. Like, so, there's I don't wanna make myself sound amazing. I'm sure there's lots of resistance that my patients have encountered sometimes, but, um, you know, like, because there's a big toolbox,
Yeah.
like, okay, supplement. Like, one person came in, a few people actually have been like, "It's not good to take vitamin D." And so I kinda went down a rabbit hole and unpacked it and came in and out of the cave, and I think my point that I'm sitting at now is that maybe we should probably take vitamin D in the winter because we don't make it, but, um, our bodies are complicated and the thing like, there really isn't an answer. Like, even the best study with the best outcome is not gonna be 100% effective,
Yeah.
whatever it is. Even exercise, even all the things that we know are amazing, like exercise, like you know, there's tons and tons of nuance and, so much individuality and everyone's different, so it's
Yep.
nice to kind of be a little bit, you know, like, on our toes, like, a little bit,
Yeah.
flexible with how
Yeah. And
yeah.
it's that like open-minded
Mhm.
um personality trait that we were talking about earlier, I think
Right.
is makes somebody a really good physician. Because I think
Mhm.
the analogy or the example I always use here is like the doctors in the early 1900s were making fun of and laughing at the guy who suggested that we start washing our hands between autopsies and deliveries
Mhm.
because they were like, "Yeah, you right, yeah, right, there's, like, imaginary, invisible, little poisonous dudes in the air," you
Yeah.
know, and, like,
Come
turns
from
out
the
germ theory is real.
yeah.
We didn't have the right tools to study it back then, and so those guys that thought he was making stuff up didn't have any evidence for germ theory, and, like, it's hard to fault them for that, and I think it's
Mhm.
really worthwhile for us to remember that, like, we are not by any means at the pinnacle of our understanding of the body
Mm.
or science or of medicine. Like, we know way more than we did 5 years ago and, that a ton more than we did 100 years ago, but we do not know everything, and it is really complicated, and I think it's really important to as a care provider to not get trapped in the, like, belief that we have all the answers
Mhm.
because it's an ego trap. It's gonna result in, like, making an unsafe space for your patients, but also
Mhm.
like, prematurely closing your mind to what the possible solutions are.
Mhm. Mhm. Yeah, I love that. Yeah, that story with Sammelweis, what
Yeah, yeah,
he
yeah.
wasn't he had his license removed.
Yeah.
That's for being like, "Oh, maybe we shouldn't deliver babies after we handle cadavers without washing our hands in between."
Yeah,
And they were like, "Famished.
yeah,
You're a quack."
yeah,
So,
you're
yeah.
good. Yeah, totally.
Yeah, a lot of humility in that.
Yeah.
It's funny though, like, you hear that story over and over, and you're like, "Oh, yeah, we would never they were idiots back then." But
Yeah,
what then, you can really, humble yourself by thinking like, "Well, what are we doing now that we're gonna be
yeah,
disgusted by in, like, 50 years or 100 years?"
yeah,
So tread kind of carefully?
yeah, yeah,
You know?
absolutely.
Yeah, live with that uncertainty a little bit, I think. Yeah, I think you're right. I think, kind of flexibility, open-mindedness, humility, curiosity is
Mhm.
important to be a practitioner and give the power back to patients because there has been an era in medicine where people have been disempowered and there's like authoritarian structures in medicine. It's like a very authoritarian system that I think is being dismantled. Like my GP feels
Yeah,
very different. I know like the new generation of doctors feels a bit different. So
agreed, yeah,
yeah.
all of my peers that are, like, our age that are MDs are very different
Yeah.
than
Yeah.
the doctors that I grew up knowing, so, yeah, it is changing,
Mhm.
slowly, but
Yeah. And patients are different too. Like people are
yep,
encountering like a doctor who's like, not really working with them and they're pushing back or looking for a different practitioner, kinda not
yep,
just accepting that answer. So this
yeah,
is, yeah, really encouraging and good. Um,
yeah,
yeah.
agreed.
I don't think we're mistaken about that in 100 years. They're like, "No,
Yeah,
no, the authoritarian systems were right." Yeah.
yeah, we'll see, but I don't think we're mistaken
Yeah,
about
I
that.
think we're good. Yeah. I
Yeah,
think
me
it's
too.
important for people to be empowered. I think that's universally a good thing.
I agree.
Um, yeah,
Mm.
any last thoughts, Jessica? And, like, anything you're offering, anything you want people to know or
Hmm. Yeah, my private practice is in Vancouver, BC. I can see patients anywhere in British Columbia, so I do lots of virtual work as well as in-person work.
Mhm.
I do have a little bit of private trauma recovery coaching, like separate from my medical practice for people that are outside of BC, if that's of interest to you, if you've got specific like psychedelic integration stuff that you want to talk to me about. And hopefully by the end of this year, I'll have a trauma recovery online program. It's
Mm.
like with my guidance, but again, like more available for people at like a lower cost than seeing me in person and also not restricted to British Columbia. But yeah, I'm on Instagram and the internet, Dr. Jessica Eastman.
Cool.
That's pretty much it.
Amazing. Yeah, I think there's a huge place for programs, like psychoeducation programs and teaching people skills and having some guidance and can drop the burden of cost down a lot. So
Yeah.
I'm glad you're offering that. Yeah. Even for
Yeah.
practitioners to take, to learn?
Yeah.
Yeah.
Totally. It's for everybody. But yeah, it feels important. Like Vancouver's an expensive city and our work is expensive. And so I am very aware that the cost of seeing you or I is not accessible to everybody. And I hate that.
Yeah.
And I also have to pay my bills. And
Mhm.
um, but it's important to me to like make an offering that makes it more accessible to more people.
Yeah, amazing. Okay, so
Yeah.
I'll have links for people to find you, and yeah, hopefully they can join in. And thank you so much for talking with me.
Yeah, thank you. It was really lovely.